Clinical trials are a way for patients to be able to get the newest of treatments for their disease, not only in the metastatic setting, but also patients that are newly diagnosed, oftentimes with lower stage disease, may be eligible for a clinical trial. The innovation comes in multiple different venues. First of all, clinical trials often test new drugs, a source of innovation. Secondly, depending on the trial, the way it's being conducted may be quite innovative. So there are a lot of trials at Yale Cancer Center that are very exciting. First of all, the types of trials, we go all the way from phase 1, which is my area of expertise, all the way to phase 3, where you're doing randomized trials to determine whether or not the new treatment, either alone or in combination with standard treatments, is better than standard treatment. We're looking at new drugs, novel drugs, which is what I do, which is extremely exciting because as we've grown to understand the biology of cancer, we're developing better and better treatments. So if we look at Smilow Cancer Hospital, Yale Cancer Center, and Yale School of Medicine, it's almost like a triad. Yale School of Medicine is where many of the faculty and staff that conduct clinical trials are housed or are employed by. The driving force for innovation for me is the technological advances that have led to the understanding of the many multitude of diseases that we call cancer. And it's through that biologic discoveries and technological advances that we're coming up with novel treatments to treat our patient, either novel drugs or novel devices or novel techniques, such as novel surgical techniques. The innovation in cancer discovery and treatment has never been greater. We're actually at what I would consider an explosion in novel treatments and novel technologies that are leading to increased life years for our patients.